Another topic we've discussed micro and nano fat transfer. You're doing skin rejuvenation with a patient's own fat that you've said can achieve things that surgery can't. Explain what it is and what it can actually do.
So try to explain this or have this discussions with patients before surgery where I think surgery is great for things like significant soft tissue laxity or jowls or platysmal muscle band separation. But I think surgery does not really accomplish a whole lot for the appearance of the skin because that's just not the right tool in the toolbox. For patients who have significant dyschromias or sun damage or fine wrinkling that I know surgery is not going to address, I think those are the patients that are best suited with a combination approach or at least a discussion before surgery about the resurfacing options that we offer, whether those are chemical peels or laser resurfacing. I think there's a lot to be said for the regenerative power of nanofat as well. And so I tend to use that frequently in patients who are undergoing some surgical procedures. Nanofat is different from microfat. Microfat is the concept of smaller collections of intact fat cells harvested from the patient and re-injected into the face in my case, or in other parts of the body in others' cases, specifically for volume augmentation. Have someone with volume loss in the cheek that I want to augment as I'm doing their lower blepharoplasty or lower eyelid surgery. That's where I lean onto a microfat for volume addition. I also really like this concept of nanofat, which is that microfat processed through a finer sieve, or essentially processed in a way that lyses or breaks up the intact fat cells in order to release their internal growth factors and various other beneficial things. That's what nanofat involves, and that's what I like to inject very superficially into the blanket of skin. Again, in the face is what I'm generally treating. That I think is not a volume augmentation, but more of a skin rejuvenation approach, where we're harvesting the healing power, the stem cell power, maybe of one's own body in order to make the skin look healthier, glowier, probably is plumper because we're stimulating collagen and maybe elastin production, and probably a host of all sorts of other outcomes that we're not quite sensitive to yet. So I like that in the well-selected patient who is already undergoing a facial rejuvenation procedure because I think it helps me to address the face and the skin more holistically.